Welcome back to the Universal Growth Network's YouTube channel on mental health education. Let's move on to our next topic. What is psychoeducation? Psychoeducation combines the elements of cognitive behavior therapy, group therapy, and education. According to the National Institute of Health, the basic aim is to provide the client and families knowledge about various aspects of the illness and its treatment so that they can work together with mental health professionals for a better overall outcome. Now, with that being said, what are some examples of psychoeducation? 1. Psychoeducation can include information given verbally in a therapy session. 2. It can include written material in the form of informational handouts and guides. Or 3. Psychoeducation can include exercises or homework assignments where clients are encouraged to discover information for themselves. Psychoeducation is considered to be an essential aspect of all therapy programs. There's a general consensus that people who have a thorough understanding of the challenges ahead of them, as well as knowledge of coping ability, internal and external resources, and their own areas of strength, are often better able to handle difficulties, feel more in control of what's going on, and have a greater internal capacity to work toward mental and emotional wellness. The benefits of psychoeducation include an increase in compliance with treatment regimens, whether administered in clinical, school, or hospital settings. Additionally, when people who have been diagnosed with a mental health condition are able to understand what the diagnosis means, they are more likely to view their illness as treatable. There are various types of psychoeducation. 2 primary types of psychoeducation are active and passive psychoeducation. Active psychoeducation consists of the active involvement of a therapist with the family during the process, which leads to interaction, questions, and clarification. In passive psychoeducation, instead of direct service, materials are provided to patients and family members. This may look like pamphlets or audio or video material. The family members and the patients are expected to read and break down the material on their own. There are 4 primary models of psychoeducation. The skill training model, which focuses on developing certain skills so that the family members can manage the illness more effectively. The supportive model involves taking help of support groups for engaging the family members of the patient in sharing their feelings. The information model focuses on providing families knowledge about psychiatric illness and their management. The comprehensive model uses a combination of the previous 3 models. According to the National Library of Medicine, psychoeducation has become a very important step in the management and treatment of depressive and anxiety disorders. After the diagnosis of anxiety and depressive disorders and performing necessary assessments, the mental health professionals should provide detailed information to the patient regarding the symptoms, causes, various treatment options, side effects of medications, need for adherence, and overall course and outcome of the disorder. Apart from medications, the role of non-pharmacological measures such as activity scheduling and regular physical exercise is emphasized. Passive psychoeducation is very popular in patients with anxiety disorder. This involves passing on to the patients various resources such as books, pamphlets, or videos which explain clearly various aspects of anxiety disorders. Unlike active psychoeducation, here the therapist does not interact actively with the patient while imparting education about the illness. Psychoeducations can target individuals, family, groups, or it can be community-based. The ultimate goal of psychoeducation is to ensure basic knowledge and competence of patients and their relatives about the illness. Additionally, the goal is to provide insight into the illness, promote relapse prevention, and to help engage in crisis management and suicide prevention.